Okay, guys, I'll just finish up with my special notes here. So you need to know what vaginal bacterial vaginosis is, how we diagnose it and treat it. There's two questions on polycystic ovarian syndrome. So know what that is and the associated signs and symptoms that go along with that. Endometrial cancers, what are some causes and risk factors for that? Ovarian cancers, what are the signs and symptoms of ovarian cancer? I did go over the STIs with you, so signs and symptoms and treatments. Pelvic inflammatory disease, signs and symptoms and treatment. And then I think the rest of my notes involve our lecture for the last lecture for this exam. So there's a couple of questions on pap smears. So how are they done? How are they collected? Where are they collected from? So know about pap smears, know about colposcopies, know about LEEP procedures, and cryosurgery. Okay. For positive HPV with low-grade intraepithelial lesions, what would we be instructing our patient as follow-up care for that? And then basic HPV education for your patients. And what are the recommendations for cervical screening? So localized cervical cancer and prognosis, as well as, yes. What is this? So anyone with heavy menstrual bleeding, whether it's in the reproductive years or perimenopausal years, what would we what would be doing if someone came in and said they had heavy menstrual bleeding? So I have a lot of questions, 8 questions, I think, 8 or 9 questions about menopause, whether it's perimenopause, menopause, or postmenopause. So you want to know the signs and symptoms. How do you differentiate between perimenopause and menopause? What is hormone replacement therapy? What are some signs and symptoms of postmenopause, or what kind of symptoms will this woman be complaining of postmenopausal, and what are some possible treatments? There is a question about soy products and postmenopause. And then know about how postmenopause affects osteoporosis and what the treatment would be, and maybe some specific instructions for the treatment for osteoporosis. And then how would you educate your patient to do pelvic floor muscle exercises? Okay, that's all I had. I'm sorry I had to run before and make this 2 recordings, but I looked up and saw the time, and I couldn't believe I lost track of time. So anyways, so I will see you when I get back.